we were both figure skaters. And now when I was like doing all this research, I was just thinking like the amount of times I've fallen on my head.
It's a really tricky balance of like, you want to get into the symptoms with concussion rehab, but to a certain point where the body can learn and habituate and accommodate, but also like you can still function the next day. Post-concussion syndrome is very real. If your symptoms don't go away after like 1 to 2 weeks, like you need to get checked and you need to get treated for it. What's up, guys? Welcome to the Physio Diaries Podcast. We are your co-hosts, Dr. Melanie Ziaziaris
and Dr. Koshevatskiy, where students, healthcare professionals, and wellness junkies come to get the inside scoop of the healthcare and wellness industry.
The podcast you didn't know you needed, by your favorite travel physical therapist. What's good, physio friends? Welcome back to another episode of the Physio Diaries Podcast. Today, we are diving headfirst, pun intended, into a topic we see more often than people realize, which is concussions. This is something that I personally have been wanting to talk about because it is super important to just me, and as physical therapists, we treat them. And there's a lot of myths out there that need to be debunked, and a lot of current research that contradicts previous research. So we're going to give you all the tea. There is so much old school shit being said that just is no longer accurate. We want to break down what concussions are, what actually happens in your body, and what to do if you or someone you know gets one. Whether you're a clinician, a student, or someone who's had a concussion or think you have, this episode will give you the latest info and tools to understand and manage it better. So we're giving you the inside scoop into concussions. I want to start off by saying, if you do get a concussion, or like a friend, family member that's had a concussion or has one, even like months after it happens, if you're still having symptoms, please go get a referral to see a physical therapist that treats concussions, because post-concussion syndrome is real, and there's just a lot of things that we treat that can get better after concussion. All right, let's
go get those referrals if you need it. But let's talk about kind of how it happens and what a concussion really is, because it's not just a little bump on the head. A concussion is basically like a mild traumatic brain injury. So it's basically you get hit. It could be like from a motor vehicle accident. It could be, we see a lot of them in like sports injuries, like football, like contact injuries, where the brain and the head accelerate and then decelerate. The brain is kind of moving around in the skull. And then this leads to a bunch of like chemical cellular changes. In our brain, we have cells called neurons. Those are our singular like brain cells. And so what happens is the brain cells get damaged and stretched or sheared in this quick acceleration deceleration incident. And what happens is there's kind of leaking of a bunch of different chemicals. We won't get into like the, the boring science details of it. But basically there's a bunch of stuff that comes in and out of the cells, and it causes this like craziness and kind of imbalance of chemicals. This whole glucose cascade happens because of all of those chemicals coming in and out of the cells. So to restore this balance, the brain basically needs a ton of glucose, and there's an energy crisis within the brain. Glucose is our main energy source in the brain. It's kind of like fast, quick energy. After a concussion, which is actually interesting, it's actually common that we see a reduction in cerebral blood flow. So our vessels to the brain actually constrict, and it's kind of a protective mechanism because we don't want to have like a hemorrhage or too much swelling and pressure on the brain. So our body's natural response is to constrict those vessels and reduce blood flow up to like 50%, some studies say, to the brain.
Yeah.
So basically, this kind of further creates the energy crisis because blood flow to the brain is actually needed for healing. Oxygen and glucose is brought to the brain through the blood vessels. And so when we have reduced blood flow to the brain, it kind of further feeds into this energy crisis that you're already experiencing initially after that injury. You know how people used to say, I remember like when we were younger, like in high school, people were like, if you have a concussion, it's important that you don't sleep because
Yeah,
like
like
what if you
stay
don't wake
awake,
up from it?
keep them awake like the whole
Yeah.
night.
Yeah. And so now
Oh,
we know that is one of the myths that we will kind of dive further into, but that's why it's important that the person gets rest and you're not like overstimulating the already tired brain that's lacking energy. So it's important to rest early on. And sleeping after a concussion is actually necessary. And that's kind of like debunking that whole myth, especially the first like 24 to 48 hours. So 1 to 2 days, you want to avoid overstressing the brain that's already like struggling. So that's kind of one thing that we wanted to mention because a lot of people still kind of believe in that myth. Like if somebody gets a really bad concussion, you shouldn't let them sleep, which is not true.
Which in fact, like you should let them get as much sleep as they possibly need. Like don't force them to stay awake because their brain needs that. And I've even like in the clinic, there was one clinic I was at and he was like a younger middle-aged father talking about how his like daughter had hit her head and they were like trying to keep her up, and like me and another therapist literally turn around and we're like, actually that's been disproven, like let them sleep as much as they want and blah 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 blah, their whole little spiel. But it was just so funny because like so many people still think that that's like accurate information, and I do think some physicians don't know the current research and evidence with concussions, and I feel like some physicians are probably still saying that too just because they don't know. I don't think that people realize like the actual chemical imbalances that happen in the brain after concussions, and I think once you know and like realize that there is this energy crisis, there's less blood flow to the brain, but we also need more like nutrients and energy, so then there's this like mismatch and imbalance. And so once you realize what is actually happening, I think then like treatment and what you do makes a lot more sense. So we definitely wanted to explain all that.
Yes.
Common symptoms, and there honestly are a lot of symptoms you can get from concussion that you might not even realize. So some of the biggest ones are headache, dizziness, nausea, sensitivity to light and sound, difficulty concentrating, brain fog, memory issues, mood changes. You can have a loss of consciousness and like nausea and vomiting, but that usually like is when it first happens. But the nausea can last. But nausea and a loss of consciousness do not predict the severity of the concussion. So there used to be a lot of like things out there that said if you lost consciousness, like, oh, that's a bad concussion. But in fact, like it might not be. Like you could probably just have symptoms for a week, maybe. I mean, everyone is different, but that doesn't mean that it's going to be like a longer recovery. What does predict a longer recovery, though, is dizziness, headaches, and amnesia. And so those are like the biggest things that like we look for as well. I mean, we look for a bunch of other things which we'll get into, but those right there are definitely going to prolong your recovery because there's other neural networks and other things that are involved in those. So it's not just like a quick rest reset and you're back to it.
Yeah, that's really interesting because I feel like they used to say, like, I remember them saying, like, if you were knocked out, then, you know, you might have like a longer recovery time. Like they just kind of associated like loss of consciousness with a longer recovery time. It's always crazy to me how like research can completely 10 years later be like, wait, this is like the old school of thought. And now we're finding that it's actually the complete opposite and this is not even correlated. We always take research with a grain of salt because we're like, this is kind of what this research study said, but you have to look at like the population and if this was directly related or if it was like indirectly related. So that's why I love research because it's kind of always changing and, you know, some things that we used to think, oh, and you're like, okay, that's completely different now.
Yeah. And it can only get better from here, right? Like I'm sure the research like 20 years ago, like what the fuck were they really doing, you know? Like was it really accurate testing?
Yeah. Some of the pre-injury factors, so things that like you wouldn't really be able to control, is if you're a female, it's just more likely that you'll have like chronic symptoms? Do you have
Fun
any
fact,
sort of,
because you said female, what's actually interesting, and I don't know if we learned this in school or I learned this after school, but female soccer players have some of the highest prevalence of concussions.
wow. And I wonder why, like, I mean, soccer specifically.
Like headbutting and stuff. I don't know.
Yeah.
That's what
But
I
they're
think of.
not wearing
But
helmets. So they don't have a
yeah,
lot of like protective gear versus like you would think football, but at least they're wearing helmets. So it like
yeah.
combats it a little. But yeah, that's interesting. But yeah, so female, and that's probably why. Any history of concussion. So if it's not your first concussion and you get another one, it's more likely that you'll have those chronic symptoms. Being of a younger age, having ADHD, which I thought was interesting. I wonder if that's
Oh
like
yeah.
related to like the
That is
neuronal
really interesting.
networks. Yeah.
Hmm.
And then
Yeah.
having any sort of history of migraines, I wonder if that just like exacerbates them. And then also
Yeah.
having a psychiatric diagnosis. So all those are pre-injury factors that could lead to like more chronic concussion symptoms.
The
Injury
ADHD
factors.
is wild.
Yeah, I know that was interesting.
Yeah.
I was kind of surprised. And I wonder if it's part of the reason, like difficulty concentrating, like if they already have some of that difficulty concentrating at baseline and then you have a concussion, it's going to make it a little more challenging. But then we talked about like the amnesia. So you can have anterograde or retrograde. So anterograde is difficulty forming new memories after the injury. And then retrograde would be like forgetting things that happened like before your this one's kind of obvious, but we wanted to talk about it. Delayed removal from sport. So if somebody has an injury, if somebody has a really bad head injury, or even like a seemingly mild one, they should be removed from sport, especially if they're young. Like they need to be removed immediately. And sometimes like it just goes unnoticed, or, you know, the kid doesn't say anything. So it's important that coaches, athletic trainers are looking out for those things and making the call when it needs to happen.
Yeah.
Lastly is post-injury factors that could lead to prolonged recovery. That would be like poor coping mechanisms, any like alcohol use, if you live alone, depressive symptoms, and like we talked about, the dizziness or headaches. So those are all like post-injury factors that can delay recovery.
Yeah. And I think a lot of those make sense too, like when you think about them, for the most part. Like obviously if you're drinking a lot of alcohol when you have a concussion, that is going to be real bad. Like not gonna help your recovery. Have you ever had a concussion?
I was gonna ask you the same thing, but so we were both figure skaters, and now when I was like doing all this research, I was just thinking like the amount of times I've fallen on my head. Like we would be skating backwards, and when I was young, I remember I fell and hit my head, and I have a loose tooth, and I got knocked out. And I remember having a slight headache afterwards, and I thought it was like I was so little. I thought it was because of my tooth fell out. And now thinking back at it, I'm like, I probably had like a very mild concussion.
Yeah.
And then there was another time in college, which I'm like, sure I had a concussion. It was just like, I didn't have chronic symptoms. We were at a bar and I stepped up onto the stage and I rammed, it was dark in there and there was a black speaker above, and I rammed my head straight into the speaker. And immediately I had a horrible headache and I was getting dizzy, and I'm sure I had a concussion then. Yeah.
Damn.
But did I do anything about it either of those times? No.
But you didn't have symptoms that lasted longer than a couple days, right?
Yeah. I remember after the speaker thing, I had symptoms from maybe the rest of the night, and then I went to sleep and I felt okay the next day. But at that time I thought to myself, like, I think I just gave myself a concussion.
Yeah. No, that's fair.
Yeah. Thankfully, thankfully I didn't have them last more than like a day, but that would be definitely, if I ever had one, that would have been it.
Yeah.
What about you?
Funny, but not funny. Well, now that you say it, because I actually, when I was younger, I was in a family friend's basement, and I was swinging on some pipes on their ceiling, and I fell and hit my went face planted into the ground, and I lost my two front teeth. But these were my baby teeth still, so they grew in fine and normal, but knocked my teeth out. Like,
oh, dang.
then they were out. I was so embarrassed. I was like bloody, but I was like, I'm fine, but I'm embarrassed.
Yeah. Did your head hurt afterwards?
I don't remember it hurting. I don't remember any symptoms outside of my teeth.
Yeah.
So
yeah.
I don't know.
I mean, that
I don't
probably
know.
took your attention away from like
Yeah.
your head or anything. But if it was enough force to knock out your 2 front teeth, like I'm sure it was like at least a mild concussion.
Yeah. In terms of skating and gymnastics, I don't remember a time where I fell and hit my head. I usually fell on like my butt or my arm or something. Like I was a pretty good like faller, you know?
Yeah.
Especially with gymnastics, like they teach you how to like fall safer. So I think I don't know, was maybe better at that because I don't recall ever hitting my head.
Yeah.
But I don't think I've ever had like a true concussion. I mean, maybe that one time, but not any time that I can remember like, oh, I feel weird. I can't do this. I can't do that.
Yeah. Yeah. I would say those 2 are like my only times. But besides that, oh, wait, no. Now I'm thinking more times. I guess I had a lot of head traumas. One time I was in my cousin's house and someone had just mopped the floors and it was like tile floor and I fell. You know in the cartoons when you slip on like a banana peel or something, I fell like that and I gained some air and then I fell on my head and I had like a huge bump in my head, like in the back of my head.
Yeah.
And later, like one of those like pine cone looking things, like on my head. And the next day, it still was throbbing and it still hurt, but I just don't remember having a headache. Like it was just more about like the weird feeling in the back of your head when you have like a bump there. And this was probably terrible actually at the time, but like there was no adult in my life that was like, maybe you shouldn't go on a roller coaster right now. The next day, I still had that bump and we went to like Canada's version of Six Flags Great America.
Oh no.
And we went on this like wooden old roller coaster and it was so shaky as it is. Like it probably would have given you a concussion even if you didn't have one. But I remember just feeling that like swelling and that like bump like moving in my head.
Oh damn.
On the roller coaster. I was like, that was probably not my best idea. But I was also probably like 7. So
oh damn.
Yeah.
You unlocked a memory I just had. I don't know. I was always swinging on things as a kid. I remember at school now, I think I was probably like 8.
Yeah.
It had to have been like 7 or 8. And I was on the monkey bars and swinging from something again. And I fell and I hit the front of my head. See, I guess I've always hit the front of my head and not the back of my head. But I had a welt like right up top here.
Oh.
Because I hit my head there. I still don't remember anything bad from it.
Yeah.
I definitely had a welt right here.
That's the interesting part to me is like how much force is like, or is concussion just defined more by like symptoms and having like dizziness and headaches versus like, then it's just like a head injury.
Yeah. I
guess
think the symptoms.
Like symptoms.
Yeah. Totally. I think the symptoms is what makes like the biggest difference. But in terms of treatment and therapy, have you ever treated concussions in clinic or any other like head related injuries in this area?
So I know you have treated concussions. I have not just because of like the clinics that I've been at. And then also I haven't taken like continuing ed specifically for concussions, but I have treated a lot of whiplash associated disorders, like they call it WAD. And whiplash and concussion actually can go kind of hand in hand because it's just a quick acceleration of the neck. Sometimes people are like, all they feel is a concussion, but then they'll also like feel chronic neck pain later on and be like, why do I still have neck pain? And that may have never been addressed because obviously people are more worried about the brain than they are of like the neck or like the spine at the moment.
For sure.
But I have treated a lot of whiplash and I had to do some continuing ed. We talked about it a little, but I don't really know about like the pathophysiology and like exactly what the treatment should look like. And it's different for everyone. Whiplash is kind of also kind of like concussion in the way where like usually the symptoms can resolve like acutely, but there's like those 20% of people that just develop chronic neck pain and like tension headaches because of the whiplash. So in our cervical spine, we have 7 vertebrae. So the most common vertebrae or like segments that are associated with whiplash or like kind of affected with whiplash is like C2, C3, so a little bit higher, and then like C5, C6, so a little bit lower. But basically the ligaments and everything in the spine gets like hyper stretched and everything just kind of tenses up afterwards because it's like a protective mechanism. But then people have a lot of neck pain and like tightness. So like they'll have deficits in range of motion. Like they can't really drive because they can't turn their head without turning their like whole entire body. In research, it says that in 75 milliseconds, that's how fast whiplash can happen. So it's super, super quick.
Yeah.
And your head kind of goes like forwards and back really quickly. And that's same kind of as concussion, but this is like, I guess, the concussion of the neck. But with chronic whiplash, people can have like really high pain intensity. They can have like sensory hypersensitivity. So they'll be like super sensitive to even just like light touch. And then they can also have issues with proprioception. So like when you look at something, you need to turn your head. But if you do those, like, you know, have you used the laser in the clinic before?
You know,
with
actually,
like the board?
For testing or treatment or both?
Both. So there's like the joint position error testing. So you have like a laser on their forehead, and then you have them basically like focus on the center, close their eyes, and then you tell them to move their head in a certain direction and then recenter on the dot. And it's crazy to see how off their cervical proprioception is after like a motor vehicle accident. So
okay, I haven't used it in that way, but that's a good reminder because I like that. And actually, not all the clinics I'm in have had the lasers. So.
Yeah. So I've noticed, at least through like treatment, because I've treated like a few. I had like a police officer that I treated. Sometimes they do like intentional collisions to like pin the vehicle, but then obviously like they have a lot of like whiplash after that.
Yeah, for sure.
So it was crazy because he was like, oh yeah, like range of motion was completely fine. Strength was pretty good, but his proprioception was not good, like kind of terrible. And I notice more like on diagonal patterns, it's harder for people to like regain control in that direction versus like horizontal and vertical, because it takes so much like fine motor movement of these little tiny neck muscles. And they're all kind of like wonky after the whiplash. So that's one thing I noticed that like some clinicians don't really look at after a whiplash injury is proprioception. And for someone like him, who like might be like, you know, tackling somebody or like fighting someone, he needs to have good proprioception for like safety on the job. So that's something that we look at a lot. But
no, that makes sense. I guess I haven't seen or that I remember too much like whiplash without concussion, because a lot of the times like I see them combined since I do see concussion. I don't see it at every clinic I've been at, but my company is really big on like concussion research and trying to get all the therapists to be comfortable with concussions. Like I can definitely tell they're trying to really push for like more continuing ed and stuff with concussions. So they're really good on that. And so in Georgia, actually, I think in Indiana, I saw more vestibular in Indiana, and then I got to Georgia and I saw a lot of concussion in Georgia. Like I've seen anywhere from, I had a 10-year-old that got a concussion because he fell and hit his head. And it was a pretty bad concussion too. Like I had to write him a school note. It was like seeing him 3 times a week at minimum. Like it was a pretty severe one.
So in the case, I know everyone is different, and because I have not treated a lot of like concussion actually at all. Like that was never like the main diagnosis. Can you tell people a little bit about like what therapists usually work on, what you would examine, and then how you would treat it, and then like if you've seen progress with people and how long that usually takes?
So I've seen the ends of the spectrum. So 10-year-old kid to soccer player and dancer, like high schooler, high functioning, high level, and then also like elderly that have a concussion from a fall. And so I've seen all, throughout that whole span. And so the biggest thing that like the evaluation is very, very specific. Like you're always going to do some type of vestibular testing, which is going to include head and eye movement and positioning. So if you are a healthcare provider or student, some terminology that you'll hear is like smooth pursuits, saccades, head impulse testing, convergence, looking at their vestibular ocular reflex. So those are like more specific vestibular things that we'll look at. Obviously, you got to clear the red flags first, but that's a whole other discussion. And then heart rate variability is huge. Also, depending on the length of time, like I've seen a post-concussion syndrome soccer player that had it for, I think when I started working with him, he had it for already like 3 to 4 months and he was still having symptoms, struggling, focusing in school, had to take multiple naps a day, also had a job while doing soccer practice every day. Like he was doing a lot because he had to do a lot, but he was struggling through everything. Like chronic headache all the time, couldn't do certain running drills because that's increasing your heart rate. And the heart rate variability is huge with concussions. And that's another big difference, how that differentiates between just like vestibular dysfunction and concussion is that heart rate variability. But your nervous system, like we said, it is in like crisis mode, right? So like all of the nerve pathways are jumbled, all of your signaling gets mismatched and it's giving false signals to certain areas, heightened signals to other areas, and less signals to other areas. So your autonomic nervous system is just all over the place. And so there's a lot of stress on the body, which is going to increase your cortisol, increase those stress hormones that are also affecting your heart rate. So your heart rate's going to be higher, but that's also going to bring on the symptoms. So it's a really tricky balance of like, you want to get into the symptoms with concussion rehab, but to a certain point where the body can learn and habituate and accommodate, but also like you can still function the next day. So the biggest thing is learning people's limit, because you could literally like, I think I've had like with this 10-year-old, I also, I'm not a pediatric therapist. So I'm like, fuck, I have a kid. And they don't always tell you what they're feeling and don't tell you when things are happening. And so I remember like our first couple sessions where like we were not doing that much. Like we did the bike for maybe 4 minutes, and he couldn't handle that.
Because he started getting a headache? Just
symptoms, yeah. And like blurred vision, like concentration, headaches, like maybe nausea. I can't remember if he had nausea. His appetite was definitely not great. And so, yeah, it really, like, concussions are so fucking variable. And that's why the initial evaluation is like so important to go through everything to really test their limits and put numbers to it. Because like if you overdo it with someone, it can set them back like a couple days because they have to recover for so long just from the treatment session. What else? Diet is another huge thing I talk to my people about too.
Yeah. One of my clinicals, I was in inpatient rehab, and I wasn't specifically on the TBI like unit. I was more spinal cord injury. But like whenever my clinical instructor was gone, I would go with this one therapist that like strictly was on TBI. Obviously TBI is just like a very, very intense, basically concussion. Or I guess a concussion's like a mild TBI. That's a better way to put it. Yeah. But basically with these TBIs, they present so differently because different people, different areas of the brain are affected. It's just so variable depending on that. And like concussion is the same way. Like some people might have completely different symptoms or different intensity or respond differently to the same exact exercise. So
For sure. For
Very
sure. And
variable.
yeah, and also how what the symptoms, like one person could have a lot of dizziness and nothing else, whereas another person, like everything is fine, but their heart rate, they just cannot accommodate and do any type of cardio because their heart rate is just so dysregulated. Like I had
Yeah.
one girl that was a dancer. The only symptoms she had was dizziness with turns and like pirouettes and stuff. So like the turning while dancing was the hardest thing for her.
Yeah.
Obviously for her, we're doing very high level stuff like movements on the Bosu ball, head movement while on the Bosu ball, like a bunch of stuff on like ball balancing and whatnot. Like you could not do that for everyone. Absolutely not. Like,
Yeah. And then
yeah.
that's another thing too with head turns. A lot of people that get BPPV, which is the positional vertigo, we'll just call it that,
Yeah.
is because of a head injury. So
Yeah.
like keeping it like simple, we haven't really talked about vestibular therapy.
Yeah.
I don't specifically do vestibular therapy, but like I can treat BPPV because that's like more clear cut, straightforward. But basically we have these like crystals in our inner ear. They're like teeny, teeny, tiny crystals. And when you have a head trauma, those crystals can become dislodged and end up basically not where they're supposed to be. And this can cause a lot of dizziness with position changes or like head turns and things like that.
Yeah.
So that's why it's important to screen for everything basically when somebody has a
Yeah.
concussion, because I was reading that it's pretty common to have like positional vertigo after concussion too. So if someone
For
like
sure.
lays down and they get really dizzy, you're probably thinking BPPV.
Yeah.
So
Once I had this one patient that probably had the worst, like she had a TBI, like it was a bad concussion, and
yeah.
it was undiagnosed for almost a year. And she was very
That's
young.
crazy.
Yeah, very young, like super fit, toned, was a pole dancing instructor, and literally got hit in the face at a concert. Got a TBI. The physicians kind of just like waved her off, and she came to me barely being able to do anything. And I was like, how has no one referred you to like anyone yet? Like, this is insane. So,
well, then why did they refer her to PT?
well, I think she got I can't remember. I think she had gotten another opinion because the original like team she had, healthcare provider team she had, like, I don't know what the fuck they were doing. Like sometimes you see cases and you're like, what is going on here? Like, how is this a thing? But she was super cool. She pretty much followed everything I told her to do, but I didn't get to see the end of her treatment because then I was leaving that clinic. But it was wild. Like I don't think I've ever seen an outpatient injury, like concussion injury, this bad. It was like every single thing that can go wrong had gone wrong. Like she couldn't go on a walk for 5 minutes before like not being able to like move and like insane symptoms.
Yeah. So how long did it take her to like with PT? How long did it take her to see like improvements and like which point did she get to?
I only was able to see her for, I think, like 2 to 3 weeks before I left the clinic because this was one of the shorter clinics I was at. And honestly, I was like, damn, I wish I could just like follow your case along. But for her, I was going to guess like 8 months, like 6 to 8 months of physical therapy because it was that bad. Like it was so bad. I felt so fucking bad for her because at this point it was so far past in the chronic phase that every single system is going off and going like wrong.
Alerting.
So alerting is a better way to say it. But it's wild.
And that is crazy. And I think a lot of people don't realize how much concussion and like headaches and head trauma can affect your day-to-day life. Like it affects your concentration, it affects your sleep, which sleep is important for every body system. It affects like your relationships, your mood. So people don't realize like that concussions are like much bigger and need to be treated because like everything else, the earlier on you treat it, the less likely it is to progress to like the chronic or like protracted phase. That's what they call it. So it's important that you go and like, you know, advocate for yourself and say, you know what?
Yes.
You might not think that this is like anything's wrong or you think I'm okay, but just give me that referral and you
Yeah.
can go and do the physical therapy.
Post-concussion syndrome is very real. If your symptoms don't go away after like 1 to 2 weeks, like you need to get checked and you need to get
that's not
treated for
normal.
it. No, that's not normal.
Yeah.
I would say even after a week, like it's not normal.
Yeah, because it said, I was reading online, usually like most like more mild concussions will symptoms will resolve after 7 to 10 days after that like glucose cascade and energy crisis. But once that all calms down, like you should not be experiencing any symptoms after that.
Have you had any family members that have had like concussions that you've like been around?
I don't think so.
Yeah, I haven't either.
Yeah. I've never like seen, like, I don't know anybody that's had a really bad concussion.
Yeah. But like in your personal life.
Yeah, not in my personal life.
Yeah, no, that's fair.
Like I mean, honestly, with elderly people, it's like probably more common too, just because like I have so many patients that have falls. Like a few weeks ago, we had a patient that literally just fell standing outside, and we like think that she hit her head because she started like having some like anterograde amnesia, and we were like, okay, like you need to go to the hospital. Yeah, and I was gonna say like the data now that like the prevalence of them, it's probably a lot more common than we think. It's just that people don't seek treatment, you know. It makes sense. I have a headache after I fell, but especially if you're older, it's so important. Like above 65, if you have a head trauma, Canadian C-spine rules, if it was like a dangerous mechanism of injury or you fell like from, you know, whatever, a certain height, you need to go to the hospital and like potentially get imaging. Because you'd rather be safe than sorry.
Yeah, and I think healthcare providers should like always pre-screen for concussions. Like elderly who fall, like that is one of the biggest like risk factors. Like if you hit your head, I'm always like any dizziness, any nausea, any like loss of appetite, any like I don't know, anything, any neck pain. I'm like always like I have a list of questions to ask them.
Right. Like there's the test that we kind of talked about, like the VOMS. It's like a vestibular ocular motor screening. That is so easy to do. Each test takes like a few seconds. And the patient just has to rate their symptoms on a scale from 1 to 10. You need like no equipment. You need like your fingertip, and that is it. So that's like something that I think most providers should know, like how to at least screen for. You don't necessarily need to know how to like treat it because there's people that know how to treat it, but like primary care providers, like they should be able to know how to do like a quick like vestibular ocular screen. And I think most do, but it's important because like that's easily going to detect like concussion or like symptoms and things like that. And also just like your subjective exam, like how are you feeling right now? What was the mechanism of injury? When did this happen?
Right. Tips for healthy brain. What do you do after a concussion? Things to look out for if you do have a concussion or know someone with a concussion.
This is kind of also like not just concussion, it's also just in general for people that even haven't had a concussion. Sleep is important, and we already talked about that. But the brain is exhausted. It had a huge injury and it needs rest. It's in the energy crisis mode, and you need a rest. You need to let the person sleep. What are the guidelines? Like, because you were saying that your patient was still napping throughout the day. So is it okay to let them nap, or do you want them to like just sleep throughout the night usually?
So for me, if it's the acute phase, like sleep as much as you need to, but once it turns into that chronic phase, like this was the soccer player that was doing soccer practice like almost every day, working, going to school. So like for him, and so for him, it was tricky because like technically you want the brain to be able to like accommodate and get through, but because he had to do so much in a day, like you need a nap to let, like he wouldn't be able to do practice and then go straight to work without a nap and like be okay at work, you know? So it's kind of the case by case, but the duration of the nap also kind of matters. Like with sleeping, the sleep cycle is super important to know. So you have like your core, like your 1 to 2, like the first 2 phases of sleep. And then you have your deep sleep and REM sleep, which is where like the healing and cellular stuff happens, like the phases you want to get to. So usually, like if you're getting under an hour, you're probably not, or at least under 40 minutes, you're probably not getting to that deep in REM sleep. So you can either let your brain rest a little bit and get like 30 to 40 minutes of sleep before you get to that, so you don't wake up groggy, or you can allow yourself like an hour and a half to try to get a full cycle. So it just also depends on like activity levels.
And I guess also just the baseline of how they were before. Like if
Yeah,
he's a 10-year-old
true.
that was already taking naps every single day, then like that would make more sense to me. Like, okay, like that was your baseline beforehand. It's okay if you have to take a
Yeah.
nap, especially if he's doing that much, or however 15-year-old.
Yeah.
Because it's like playing soccer, going to school, and then also like working. So
Yeah.
I'd be exhausted too, and that's also
Yeah.
like a time where your brain is still developing a lot. Like, it's like post puberty, but still like you're growing a lot, like your brain is changing. So like,
Yeah.
that's why I was curious. I'm like, do you let them nap?
Yeah. But
And
I
like
will
how much?
say, yes, for sure. I was going to say on like the end of the spectrum, if you're getting like 9 to 10 hours of sleep at night and then you feel like you have to nap for like 3 hours, like to me, that's alarming for anyone. Like you
Yeah.
shouldn't have
Oh,
to
yeah.
require that much sleep if you have a concussion or not. So
Mhm.
there's something
Yeah.
else going on that's making you need to sleep that much as well.
Right. Yeah. So sleep is important. And that's just also
Yes.
for anyone, right? Like it's
Yes.
important. And I actually noticed this too, because I minimum get 7 hours of sleep every single
Oh,
night.
that's really good.
But it's really weird because some nights or some mornings I'll wake up and I feel absolutely exhausted. I'm like,
Yeah.
what is going on? But some mornings I wake up and I feel very rested, but it's the same amount of
Yeah.
sleep, about
Yeah.
the same. But like you said, it's important that you don't wake up through like a deep sleep or like a REM sleep. Your alarm doesn't wake you up in those times. I think there's some like apps, and if you have like an Aura Ring or something, or like a Hatch alarm, if you can set your alarm to wake you up at the end of your sleep cycle, you'll feel a lot more rested than if you're just randomly setting your alarm. So that's something that I kind of want to start doing.
Yeah, I was gonna ask, wait, do you track it on your Apple Watch? Do you have Apple Watch? I
Yeah, I
thought
have
you
an Apple
did.
Watch,
Do
but
you
it
track
dies
it?
really quick. No, I have
Oh,
some nights, but I want to get some kind of alarm that would like wake me up at the end of like the sleep
yeah,
cycle, or like
that's
at least
fair.
count if I go to sleep at a certain time, like what would be like the best or ideal time to actually wake up to feel more
Yeah,
rested.
that makes
Because
sense.
like it is important that you kind of develop like a good sleep schedule, like going to bed around the same time every night,
Yeah,
to kind of help regulate like your sleep hormones.
yeah,
But it's also important to like wake up at the right time, I guess.
yeah,
So
that's fair.
yeah.
I've been obsessed every single morning. The first thing I do is look at my like sleep stats because I got the Apple Watch
Oh
now.
yeah.
So I sleep with it every night and I'm like, how much REM did I get? How much deep did I get?
Yeah. No, it's so cool that like it can track it
Yeah,
and everything. I've had my Apple Watch for a few years and I need to get a new one because my battery doesn't last that long anymore.
yeah, that's
But
valid.
it's fun to look. I was thinking about getting the Aura Ring because it'll give you like a sleep score, I think.
Oh, yes,
Um,
it does. I forgot about that.
yeah, and I'm thinking about getting an Aura Ring, but I don't. We'll see.
After you're up.
Yes. Yeah. Maybe for my birthday or something.
Yeah. Okay. Next topic is diet. And this one is huge. Y'all know how crunchy I am and how much I love talking about nutrition. But with concussions, it's especially, I mean, for anyone, but especially concussions, it is super important because the foods and what you're eating will actually make a difference in your recovery. Like, I promise you that. So, with anyone, especially concussions, we want to focus on whole foods and not processed. So, no like granola bars, no cereals, no, I don't know, like frozen meals, like none of that shit. Prioritize whole foods, vegetables, fruits, lean meats, fish. If you eat fish, like we need foods really high in omega-3 fatty acids because that helps the brain like so much. Like we need, regardless, the American diet just has less omega-3 fatty acids just in our like vortex. So we have to kind of go out of our way for it. And so supplementation can be really good for these, like fish oil as well. But like your nuts, your fish, your salmon, your beans, legumes, because of that glucose crisis, you want electrolytes, fluid, water, carbs, complex carbs. So fruits, vegetables. I also actually saw something that said creatine supplementation can really help with concussions. And in that acute phase, you can take up to like 10 grams and then go down to like the 5 grams is usually what like most people do per day. But the creatine can help reduce dizziness and headaches and brain fog, which I thought was really interesting.
Yeah, because like you have this like higher energy demand.
Yeah.
And so creatine can help with like energy. And that kind of makes sense because the brain's like the ATP pump is like working in overdrive. So yeah, that makes sense. Creatine should be one of like the next, like health trends that we talk about, because I've heard of a lot of recent studies coming out for just like so many different things. And I'm interested because like Hippo, my boyfriend, takes creatine like I think every day almost.
I do too.
Yeah. And a lot of people have started taking it, and there's like good research studies that are finally coming out. So
that's what I do. So I thought that was interesting. Magnesium, always, like any type of magnesium supplementation, I think would be great post-concussion syndrome. And then I saw something about green tea, and I think the reason why green tea is because it has a lot of L-theanine, which is an amino acid, and like matcha has a lot of that as well. So I think it's just because of like what's in the green tea and like a lot of antioxidants that are good for the brain and body. Obviously, things to avoid: alcohol, any type of alcohol that's going to disrupt your brain functioning, high caffeine. So like limit the energy drinks or no energy drinks. And those are also super processed. So like we don't want that. And processed foods, like I said. Funny story, actually. I had this one patient who also had a pretty bad concussion and like very much chronic post-concussion syndrome. But she would come to PT and she would not eat because she had the worst appetite. Like she had no appetite after her concussion and like injury. And I talked to her about it a lot, and I put her on a little, she actually followed everything I said. I really liked her. She was cool and she listened to me. So that was also great. And I put her on a like diet of the week. And so I would tell her, do this before PT. I had her go get, because she wasn't like literally eating anything, I had her go get these, I think it was the OWYN protein drinks at like Publix. She would have one a day. And those are like 20 grams of protein per like bottle. And then I put her on like a fruit and veggie schedule. So she would go to the store and get, I think it was 4 apples. I think it was green apples. I can't remember which apples she liked. 4 apples, 4 cucumbers, 4 oranges, because those were the ones that she liked. Like we went through a whole list of things she doesn't like. And I said, all right, 4 of these, 4 of these, 4 of these. And like eat at least one every day and like alternate and switch it up to at least get some type of nutrients in your body, because she legit would eat nothing. And I was like, all right, how are we going to eat something? Because you can't come to PT, deplete your energy that's even more depleted, and like and you're going to feel like shit, of course.
Lightheaded. Yeah. It's just going to exacerbate all her symptoms.
Yeah. So I was like, all right, we got a food schedule going. Like at least let's get some whole things and some protein. And I think I also had her do Greek yogurt. I'm sure I did. I always tell my patients to do Greek yogurt. But
it
was funny.
That I have that come into physical therapy for, if you have like a 7 a.m. appointment, I get it. You haven't eaten yet. But if your appointment's at like 11 o'clock, 1 o'clock, and you tell me that you haven't eaten, like physical therapy is out. Like regardless, like for anybody, concussion or not, like you need to eat before your appointment, because we are going to put you to work. And I've had so many people get like dizzy or lightheaded, and thankfully we have like juice boxes in our clinic, because people's blood sugar drops, even if they don't have like, diabetes or anything. You need to eat, because exercise lowers your blood sugar because your cells are working and they need energy. So,
Yeah.
oh my gosh, the amount of people I have to lecture, I'm like, eat a banana, eat something, get some sugar, some kind of energy in your system. Like you can't just have water. You can't just have coffee. Like that does not count.
That doesn't count. Nope.
Yeah.
Yeah.
And especially if you have like this energy crisis or you have the concussion syndrome, like you need to eat. Even maybe you don't have an appetite, like you need to eat.
For sure. Like even just electrolyte drink mix. Like I don't like Gatorade because it has so many simple sugars in it and like added sugars. But I do like Body Armor because they have the 0 calorie. Like if you want a cheaper option, they do have the 0 calories. So it's just a bunch of just like electrolytes. But like electrolytes, we need electrolytes, people.
Yes, we really do. I feel like we hear a lot about this with like dementia and Alzheimer's and like kind of comparing those people that like live to 100 and like are still really sharp and compared to those that are like maybe in their 60s that already have like signs of like forgetfulness or like early onset dementia. It's critical that you have social connections because we are social beings, and just some sort of like purpose, you know, in life, I guess. So that's why it's so important for like older people to have like either some kind of hobby or it's some like book club that they do or volunteering at like the zoo or the aquarium, like something you have to do, because that's just going to impact your brain health so much. Or like even doing like crossword puzzles or like just learning some new sort of activity. Like I've talked about this before, but right now I'm learning how to dance. And I'm like not much of a, like I can dance, you know, like really like whatever, just stand there and go side to side, but like an actual type of dance or like taking an exercise class or like something that can kind of challenge and stimulate your brain is like super, super important because I feel like when we're in school, like we're learning so much and our brains are like growing and making new connections. And then I don't know about you, but after PT school, I was like burnt out from learning for a sec. I was like,
definitely.
Let me just stop for a second. I didn't read a book for so long. Yeah. Anyways, it's so important that you know, keep your brain active. It's just like a muscle in your body. The brain is basically like a muscle. And for those neuronal networks to be strong, you have to use them and you have to build new ones. So it's important to have like good social connections and just like stay learning your whole life.
Definitely. Community is just even being like a younger person, like who you don't really think about community, but like now every year I'm like, oh wow, I do really miss having a community and like consistent social interactions and stuff like that. Like it really does make a big difference.
Yeah, like the Blue Zone documentary, like all those people have such a strong sense of community. Like they all like cook meals together. They like you get your produce from like maybe this guy that you've been going to for like 10 years and you get this from this guy. You go to like your fish guy, your meat guy, your you know, so you kind of know the people in your community and then like you have like regular events or like meetings that they do and like that's a big thing that I notice in like the Blue Zones apart from just their like diet and lifestyle and just like, you know, exercise, but social connections is very important in like just overall brain health.
Last but not least, stress levels and nervous system regulation. Pretty much. With concussions, like we said, you have that glucose cascade, but you also have nervous system dysregulation. Like your nervous system goes crazy because it doesn't understand what's happening and it's trying to recover, but it's also like skewed now. A lot more cortisol running through your system. So when you have high cortisol levels, it actually shrinks areas of the brain like the hippocampus, which is related to our memory. So a lot of different pathways that are affecting other things in the brain and nervous system. Anything that's going to help to, like we always talk about nervous system regulation, what the fuck does that mean? Anything that allows you to get into a state of calm and relaxation where you're not on a high drive, go, go, go mentality and your body isn't on a high drive mentality. And so like yoga, meditation, just like sitting somewhere, being on a beach or by the pool or, you know, sitting in your house without any distractions and a lot of sensory input around you, like no noise or limited noise. You can do sound frequency like music. You can do red light therapy. You can do a bunch of other things to just help like calm your nervous system down. Like we just talked about in our episode with Angie, you can do chanting and like humming and mudras and other stuff to help like relax our nervous system. But that also goes hand in hand with that heart rate variability that I talked about that happens with concussion. So like our heart rate and our nervous system go hand in hand. So if our nervous system is upregulated and like super high drive, high sensitivity, so is our heart rate. And so we want both to be able to accommodate and get lower together. And so that goes hand in hand with that. That heart rate variability is going to be huge because usually with concussion, if your heart rate gets higher, it's going to bring on your symptoms. If your heart rate's higher, your nervous system is upregulated. So everything is just going to go off of each other pretty much. Taking care of your nervous system is huge.
Yes. Take care of your nervous system, your brains, wear helmets when you can bike.
I want to say cut people off if you need to. Do what's best for you.
Yeah.
Protect
that precious brain.
Protect your brain, protect your peace, protect it all.
All right, guys, there you have it. That is the inside scoop on concussions. I think that was a great episode and very informative because there's a lot of myths and things out there that don't necessarily hold true with like current research. So we just wanted to bring that to you guys today. Concussions are not just a bump on the head. It's really a complex brain injury, and PTs like us are able to treat it, and it's something that you should get treatment for and advocate for yourself if you feel like you need it. If you enjoyed this episode, please follow, subscribe, and rate us. It just takes a few seconds, and do it on your favorite podcast app, whether that's Spotify, Apple, or wherever you listen to your podcast to. Leave us a review as it helps us grow our podcast even more and just get more amazing guests and ideas for you guys in the future. So thank you guys for listening, and we'll talk to you guys next week. Bye.
Bye.